Hello, this video has been created to help you understand your proposed surgery. It has been made using AI technology. It is designed to support you in making an informed decision about your care. Watching this video does not replace discussions with me or my team. Instead, it is designed to give you additional information and to answer some of the questions you may have. You will have the opportunity to ask further questions in clinic before deciding whether to go ahead with surgery. What is a total knee replacement? The knee is a hinge joint formed by the thigh bone, shin bone or tibia, and the kneecap. In a total knee replacement, the joint is actually resurfaced rather than fully replaced. The damaged surfaces of the knee are removed, usually by trimming off 5 to 7 millimeters of bone. These surfaces are then covered with metal components. A plastic insert is placed between them to allow smooth movement, and the undersurface of the kneecap is also usually resurfaced with a plastic button. The aim of this is to reduce pain and improve function. Why might this surgery be recommended? A total knee replacement is usually considered when knee pain is severe or long-lasting, pain affects everyday activities such as walking, climbing stairs or sleeping, and other treatments have not provided enough relief. The most common reason for knee replacement is osteoarthritis, but other causes include inflammatory arthritis, previous injury, or knee deformity. Expected benefits. The main aims of knee replacement surgery are to reduce pain, to improve function and stability, and to help you carry out daily activities more comfortably. Most patients experience good improvement, but the knee may not bend as far as a normal knee, some pain or stiffness may remain, kneeling can be difficult or even uncomfortable, and the skin on the outer side of the scar will typically have a numb patch of variable size. What does the operation involve? A knee replacement is usually carried out under a spinal anaesthetic with sedation or a general anaesthetic. The surgery usually takes just under an hour. In the operation, we normally use custom-designed instruments made from your planning scans, which enables us to be very accurate in terms of the size and shape of the implants that best fit your skeleton, as well as how they are implanted. This directly affects the success of your surgery. After surgery, we typically leave a drain in the knee for 24 hours to allow some of the fluid and blood to be removed from the joint. Ice is key to recovery and is applied in theatre recovery. Most patients will continue to ice the knee intermittently for up to 6 weeks after surgery. Patients typically stand or walk with support on the same day or sometimes the following day. Hospital stay is usually 2 to 4 days depending on your home circumstances, and physiotherapy begins early and continues after discharge. Risks and complications. All surgery carries risks, and it's important you understand these. Common risks include pain, swelling and stiffness, reduced knee movement for several weeks, bruising and ongoing discomfort when kneeling. Less common but more serious risks include infection in the wound or joint. This is serious but rare, and in my practice occurs in under 1% of cases. Blood clots in the legs or lungs. This is uncommon, and we start patients on aspirin the day after surgery to reduce the risk of blood clots. If you are usually on blood thinners, we will make a plan with you to stop them a few days before surgery and usually restart them after 24 hours. Stiffness can occur, but is generally addressed with physiotherapy and exercises. Rarely, patients may come back into theatre for a manipulation, typically at 2 to 3 months after surgery if the knee has got very stiff. Nerve or blood vessel injury and fracture of the bones are uncommon but can occur. Longer term risks include wear or loosening of the joint, persistent pain, and the need for revision surgery in the future. Your personal risk will depend on your overall health, weight, smoking status, and other medical conditions. Recovery and rehabilitation. Recovery from knee replacement takes time and effort. Most patients use walking aids for 3 to 6 weeks, take part in daily physiotherapy exercises, and gradually increase their activity over 6 to 12 weeks. Improvement will continue for at least 12 months after surgery, and achieving good knee movement depends on regular exercises over a long period of time. Patients shouldn't drive for 6 weeks after surgery on the right side and 4 weeks after surgery on the left side. How long will the knee replacement last? Modern knee replacements are designed to last many years. Most will last 20 years or longer. Younger or more active patients may need further surgery later in life, but the majority of knee replacements done today will last for the duration of the patient's life. Making your decision. It's important that you understand the benefits and risks, have had your questions answered, and feel you have had enough information to make a decision. You can take time to think about this and discuss it with your family, carers, or your healthcare team. You may also choose to delay or decline surgery. Next steps. If you have any questions after watching this video, please make a note of them and we can discuss them at your next appointment. At that appointment, we usually review the 3D planning for your surgery together. I will show you what the new joint will look like and explain how the planning decisions were made. We will also complete a consent form together. Thank you for taking the time to watch this video, and we'll discuss things further in clinic.